Hey, if you're suffering from low back pain, I want to help you find out if it's a back problem or a hip problem. Because one of the most things I see in the clinic with patients who come to me complaining of low back pain is their hips aren't rotating well enough. So today I want to give you two simple tests that you can do to find out where the problem's coming from. But first you must know the reason why we need to check the hips and really full body movement is because everything works together. Now, for example, when you go down and pick something up off the ground, it really requires the back to move and it requires the hips to move. When you turn throughout the day, say to look at something to your right or to your left, it requires back rotation, but it also requires hip rotation and it requires ankle rotation, but we're not going to go in that today. We will focus on the hips. And the reason why is because I find that hip rotation is usually the thing that people lack. Okay, but I also want you to know there's a couple different movements. So your hips do flex, they come up, they go out to the side, they come in, they go back, and then they rotate. So you've got quite a few different movements that the hips can make. They're very mobile. And it could be any one of these that you're lacking, but I really want to focus on the rotation. A couple points that I do want to make is the amount of hip rotation compared to me versus you can be variable, or in general, it's women have a little bit more mobility than men. And so I don't want you to necessarily compare you versus someone else. Compare side to side. So I'm going to show you exactly what I mean by that. You'll be comparing right rotation compared to left rotation, or right hip compared to left hip. But all of us should have the amount of mobility which is present with the two combined. Now the way that we can test this out is you can grab a mirror. I got a mirror and put it directly behind you. Now I want you to stand right in front of the mirror with your feet together. Now while you're standing there, maintain your feet on the floor, maintain them being together. What you'll do is keep your arms to your side, and I just want you to turn as far left as you can. Now, I'm not sure which way this is showing you, but I'm actually turning left. It might look like right. But turn left as far as you can. You should be able to see in the mirror your front shoulder. You should be able to see the front of your front shoulder in the mirror. So when I turn left, I can see my right shoulder. I can see the front of it in the mirror. That means that I have adequate hip mobility and back mobility combined. Now go the opposite way and you should be able to see your left, the front of your left shoulder in the mirror behind you. And again, that means that you have adequate mobility combined. What I want you to notice is, does one way move better than the other, or is there any discomfort or pain, or do you feel tight? So let's break those down. So again, this requires ankle, hip, and back mobility. Let's look at back and hip mobility first. Okay, so this is a stretch that I call, or rather it's a test, but you also turn it into a stretch, kind of debating what you feel side to side. So you're gonna have, this is my right hip, and you'll have it straight to the front. And then you wanna have 90 degrees at your knee. Let me back up here. You have 90 degrees at your knee, your hip is directly to the front. Okay, then you have the hip on the side here, and you have 90 degrees at the knee. What I want you to do is try and have your trunk straight up and you're facing forward. Note how that feels. Any discomfort, any tightness, any sort of symptoms. Then what you're gonna do is switch sides. Okay, this is my left hip to the front, same thing. I've got my hip is to the front, my 90 degrees at the knee. My other hip is directly to the side of my trunk. I'm 90 degrees at the knee, faced forward and sitting up. Does it feel different side to side? And this feels quite a bit tighter to me. So I know that I need to sit in this stretch and I need to try and work out this hip in this direction because it's a little bit limited there. Okay, let's test the next part. Let's test our spine. Let's see if one is limited, rotation is limited one direction over the other. What I want you to do is grab a pillow. You'll take a pillow and you'll put it between your knees and you'll just lightly squeeze it throughout this entire movement. Then you'll cross your arms and you're gonna rotate to the right. Notice how that feels, any tightness, any discomfort. Then you're gonna rotate left. Notice how that feels, any tightness or discomfort. And for me, it feels a little bit better going to the left than it does to the right. So what I want to do is I want to open up that right trunk rotation. So I'm going to show you a trick, and this is pretty magical. But what you'll do, you're going to rotate right, then you're going to side bend, then you come back up, and I want you to, on the exhale, I want you to rotate further. Side bend, come back up. On the exhale, rotate further. Side bend, come back up. On the exhale, rotate further. And there I am. I just opened up my rotation. Pretty crazy how that happens, and you should find that too. But make sure when you do it, you rotate as far as you can, you side bend, you come back up, and then as you exhale, rotate further. The biggest thing that people make the mistake on is they rotate, side bend, they come back up, and they unrotate. Don't unrotate. Make sure you rotate, side bend, come back up, and exhale, and rotate further. That is a quick way to open up your trunk rotation depending on what you need. Okay, so now you know that the hips and the back work hand in hand. They work together. They're really a single unit. And you found 2 quick ways that you can test yourself on, is there a back rotation problem or is there a hip rotation problem? And I also gave you a couple of exercises that you can do to try and open it up. Now, if you've been suffering from back pain for a while and you're ready to look for a solution and find out where the other problem is, right now I'm currently offering a free visit where you can come in and sit down with me for about 45 minutes, and I'll check and see how you're moving from head to toe, and I'll find out if it's a hip back problem. It can even be an ankle problem. It can be an upper back problem. And we'll dive into it and find out exactly what's going on and how I can help. If you are interested in setting that up, what I want you to do is go ahead and just click the link around this video and come on into the clinic for this free appointment and see how we can help. All right, thanks so much. Talk to you soon.